Hi, Mr. M. My name is Stacy. I'm a nurse that is going to be performing your physical assessment today. It's nice to meet you.
Hi.
Hi. I'm going to wash my hands and then we'll get started. So I'm going to go from head to toe, and if you feel any discomfort or pain or anything, let me know, and we'll stop right away. Okay? All right. So I'm going to first start with your head. I'm going to inspect your head here and feel it for any lumps or bumps. No lesions, no mass is felt, hair is thick, no pattern of baldness. I'm now going to palpate for some edema on your eyelids and below your eyes. So I'm just going to press lightly here, and no edema is felt there. I am now going to palpate your temporal arteries. So I'm just going to touch your face right here and right here. Good. Temporal arteries are palpable at 2+. I'm going to feel your carotid arteries. And here. Good. Carotid arteries are palpable, 2+. I will now auscultate the temporal and carotid arteries. I'm just going to put my stethoscope here. And begin over here. Here. And here. Okay. No bruise heard on auscultation. Now I'm going to palpate your sinuses, so just let me know if you feel any tenderness or pain when I'm palpating. Any pain?
No.
No. Okay. Now, if you could open your mouth for me. I'm going to look in your mouth. And can you raise your tongue up, down, move it side, the other side. I'm going to take my tongue depressor here, and I'm just going to look on the sides. Good. The mucosa is pink. You can close your mouth. The tongue is midline. The dentition is good. And I would then elicit a gag reflex by touching the tongue depressor to the back of the throat. Any diminished gag reflex could indicate a lesion on the vagus or glossopharyngeal nerve. So let me set this away. I'm now going to check your extraocular eye movements. So if you could just start by looking straight ahead, and then just follow my finger with your eyes. Good. Extraocular eye movements are intact. I'll now test the peripheral vision. So if you could just tell me when you can see my fingers coming around.
Yep. Yep.
Okay, peripheral vision is intact. I would then test the vision, visual acuity using the Snellen eye chart, which we don't have, but if we did, I would ask Mr. M to cover one eye at a time and read down a list of letters, and then until he couldn't read them anymore, from large to small, and that would determine the visual acuity of each eye. So I will now take the ophthalmoscope, and I will look at the back of the eye. So if you could just look straight ahead. Good. Now we'll come over here. Good. The optic disc margins are sharp. There's no hemorrhages or arterial or hemorrhages noted. I will now check pupillary reflex. So I would dim the lights, and then I will use my pen light and just look straight. Okay, pupils are 4 millimeters. They restrict to 2 millimeters. they are reactive and accommodated to light. I'm now going to inspect the ears. So I'll just do a visual inspection of the outer ear on both sides. The auricles and the surrounding tissue are without lesions or masses. I will now take the otoscope and look into the ears. The tympanic membrane is pearly gray, it's intact, and reacts to the light. So now I'm going to do some hearing tests. So I'm going to take my tuning fork and I'm going to place it on the top of his head and ask him if he has any difference in hearing from side to side to test for lateralization. Any difference or?
It's the same.
Same, okay. I will now test for hearing conductivity, bone versus air. So I will have Mr. M tell me when he no longer hears the sound, and then I will move the tuning fork. So I'm going to go behind the ear here and have him tell me when he no longer hears the sound. Try the other side. So for normal hearing, air conductivity is usually greater than bone conductivity. So very good. I will now do the whisper test, and I will ask Mr. M to repeat the letters that I'm saying, and letters and numbers in combination, there'll be 3, okay?
Three, you, one.
Very good. And try this side. And I'm standing approximately 2 feet behind him.
7C2.
Okay, very good. Very good. So now we will move on to testing for lymph nodes. So I'm just going to feel the lymph nodes down under his neck, down to the axilla area, and in which case the gown would not be on at this time, and down into, from the clavicle to the axilla area, and no adenopathy is noted. We'll now move to cardiac and do an assessment of the cardiac system. So I will first palpate the pulses, and we'll palpate the brachial bilaterally, radial, okay. I would have him lay back, palpate the femoral arteries, the popliteal arteries, the posterior tibial arteries, the posterior tibial arteries on both sides, and the dorsalis pedis on both sides. all are palpable and 2+. I will now have him turn on his left side and palpate the PMI, or the point of maximum impulse, which is mid-clavicular line below the nipple. And it's also palpable at 2+. So now I'll have him sit up again, and I will auscultate the heart. Okay, I'll now use the bell of the stethoscope. S1 and S2 are crisp, no murmurs or adventitious sounds heard. I'll now ask him to lay back again so I can auscultate his aorta and other arteries. So I'll auscultate the aortic artery, his renal arteries, the iliac arteries, and the femoral arteries. Okay. No bruits heard on any of the auscultation of the arteries. So you can sit back up. So now we'll move on to, I'm going to check the capillary refill on your fingers. Okay, capillary refill is less than 3 seconds. Now we'll move on to your lung assessment. So I'm just going to move to the back here. I'm going to place my hands on your lower back. Can you take a deep breath in? Good. Breathing is symmetrical and easy. And now I will auscultate the lungs. So I'm going to have you take a deep breath. I'm also going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Lungs are clear to auscultation, no adventitious sounds heard. So I will now test for tactile fremitus. So I'm also going to have you say 99 as I touch different places on your back and your chest, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Tactile premises heard in all fields of the lungs. I will now percuss your lungs. So you're going to feel me tapping on your back and then on your chest. So. Okay, percussion is resonant through all the lung fields, which indicates healthy lungs. I would then check his pulse oximetry with an oximeter that goes on one of his fingers that would read the percentage of oxygen in the capillaries at the end of his fingers. So normal for adults is 94 to 95%. I would also use a spirometer to check his forced vital capacity. So I would use the spirometer, have him exhale as strongly and as long as he could to determine his lung capacity. So I will now move on. We'll move on to the abdomen. So if I could have you lay back. Right now the gown would be off, and I would visually be inspecting the abdomen for any lesions or marks or masses that I could see that would be visible. I'll now auscultate the abdomen, all four quadrants, starting at the right lower quadrant. Ideally, I would listen to all areas for about 2 minutes, but in the interest of time, we'll just discuss it. And all vowel sounds present in all quadrants, normal, active. I would now percuss the abdomen. So most of it is tympany. I would percuss in the right upper quadrant until I heard dullness, and then down from under the nipple line until I felt dullness, and that would indicate the liver span, which there. And then on the left upper quadrant, I would percuss down the mid-axillary line until I heard dullness, and that would indicate where the spleen was. But sometimes it's very difficult to find in adults, so it may remain tympanic throughout. So I would then lightly palpate the abdomen and ask if there's any tenderness felt with any of this palpation.
No.
Okay. No tenderness on palpation, no masses felt. For deep palpation, to determine liver span and the spleen and the kidneys, I would place my hand behind the back and push right under the lower rib and ask Mr. M to take a deep breath, let it out, and then I would push to determine the edges of the spleen. I would move down a little bit further into the mid-abdomen and then ask the same thing to determine to feel the left kidney. I would then go on the other side, hand behind the back, push on the abdomen for the right kidney, and then above, under the ribs and the back for the liver. A lot of times the kidneys and the spleen is not palpable in adults, but the liver is palpable at 7 centimeters below the nipple line in the right upper quadrant. I will now do some musculoskeletal observations. So let's sit up, and we're going to start by visualizing all the joints, the neck, the shoulders, the elbows, the wrists, the hips, the knees, and the ankles. And now we will, I'll test the strength and range of motion of all the joints. So we're gonna start with the neck, and we're gonna test the flexion of the neck. So if you could put your chin to your chest and then raise your head up and look up to the sky. Great. Come back to midline. Look to the left and then to the right. And then if you could put your ear to your shoulder on both sides. Yep. Okay, and I'm going to test the strength, so I'm going to have you push down against my hand as you look down. Good. And then I'm going to have you push against my hand as you look up. Good. And then I'm going to have you push against my hand as you turn to the good side and this side. Good. Range of motion is unrestricted in the neck, it's smooth, and strength is a 5 out of 5. We're going to assess the shoulder range of motion now, so can you raise your arms above your head? Good, can you put them down? And then move them to the back of you, good, thank you. And now we're going to test adduction, so can you cross your arm individually across your chest, good. Good, and I'm going to test the strength. I'm going to have you push, I'm going to try to hold your shoulders down, can you push up against my shoulders? Good, thanks. Range of motion in the shoulders is unrestricted and smooth, and the strength is 5 out of 5. We're going to do the elbows. So if you could bend your elbows, straighten your arms, and then hold out your arms with your palms down, and then flip your palms up to the sky. Good. So you can put them down. The range of motion of the elbow is smooth and intact. And now we're going to do the wrist. So if you could hold your arms out, can you point your fingers up to the sky, point them down to the ground, hold them straight out, point them in, and then point them out. Good. And I'm going to test the flexion and extension strength and also hand grasps. So if you could hold your arms out, can you push up against my hands with your wrists and then push down and then grab my hands, squeeze. Good. Strength is equal and bilaterally 5 out of 5, and there's good range of motion in the wrists. Now we'll have you lay down and look at your hips. Okay, so can you bring your knee up and towards your chest? Good. Other leg. This is flexion of the hip joint. Other leg. I would then have him move over to the side of the table and hang his leg down across next to the table to test for extension of hip joints, but this table isn't really conducive to that, but that's how we would test for the extension of the hip joint. I'm going to have you raise your leg up for me. I'll help you. Have your leg move out to the side for abduction and across the other leg for adduction. Same thing on this leg. Out to the side for adduction. In for abduction. Okay, and now if you're going to bend your knee up like to your chest again, one at a time, please. And can you push against my hand? Good. Can you push against my hand? Good. This side, push against my hand. All right, and this, push down. Okay. Range of motion is intact and smooth in the hips, and the strength is a 5 out of 5. So I'll have you bend your knees. Can you straighten your legs? Good. Knee range of motion is intact. I'm going to have you push against my hands, okay, and then pull against my hands. Good. Knee is 5 out of 5. You can sit up. I'm going to have you move back a little bit so we can see your feet. Yes, thank you. Can you lift your toes up to the sky? Point them down to the ground. Move your heels inward and your heels outward. All right. So we're going to test Plantar flexion by pushing down to the ground. Good. And dorsiflexion by pulling up to the sky. Good. Strength is 5 out of 5, and range of motion is smooth and intact. I'm going to ask you to get on the floor, and we're going to test the range of motion of the spine. So if you could bend down and touch your toes. Good. Stand up and lean back a little bit. Good. Bend to the side, and then the other side, and can you twist? Any pain or any? No. So range of motion is intact with the spinal movements as well. So now I'm going to ask we'll test your motor abilities, and we will have you walk across the floor. So just go ahead and walk. Good, you can stop. The gait is easy, the arms are swinging at the sides, and the turning is smooth. Now I'm going to have you walk with heel to toe across. Good. Tandem walking is intact there. I'm also going to have you walk across the room on your toes. All right, good, you can stop. Plantar flexion is intact, and balance is good with walking on the toes. Now can you walk back on your heels? Good, you can stop. Dorsiflexion of the ankles is intact, and balance is good with walking on the heels. So now you can go ahead and sit back down, and we're going to test some of your reflexes. So I'm going to take the reflex hammer, and I'm going to test your brachial reflex. So good. Good. Your patellar reflex. There you go. Good. And your Achilles reflex. Okay. Reflexes are brisk and intact in all areas. Now we're going to do a few more motor exercises. If you could put your heel up to your knee and slide it down your shin on both sides. Good. Motor is intact. We're going to test some cranial nerves. So could you open your eyes wide, raise your eyebrows, clench your teeth, stick out your tongue, smile. All right, good. Open your mouth. Sorry. Say ah.
Ah.
All right, so your cranial nerve 5, cranial nerve 7, 9, 10, and 12 are all intact. Now I'm going to have you tell me dull versus sharp for sensation. So if you close your eyes, so you're just going to tell me if you feel sharp or dull. Okay? Okay. Sound good?
Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay, and we're going to do it on your arms and your legs as well.
Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull.
Okay. Sensation is appropriate throughout. I'm now going to, we would test your corneal reflex as well to test your cranial nerves, and I would just take this wisp of cotton and make sure that when I touched the cornea of your eye that it elicited a blink. And so we would do that on both eyes. And then I'm going to test proprioception. So I'm going to grab your toe, and I want you to just keep your eyes closed, and you're going to tell me whether I'm lifting your toe up or pushing it down. Okay?
Up, down,
Okay, and on the right side?
down, up, up.
Okay, good. And then we're going to test, I have some objects over here, and I'm going to place them in your hand with your eyes closed, and I just want you to identify the objects.
A pen,
Okay, and then other hand.
a key,
Okay. So stereognosis is intact. I'm going to ask you to hold your hands out, palms up, and I'm going to draw a number in your palm, and I want you to identify which one it is. So close your eyes.
a 3, seven,
So good, very good. They're correct. So no graphesthesia is present. I'm now going to ask some orientation questions. So can you tell me your name
David,
and where are we right now?
Old Lime,
And what month is it?
August,
Okay, he is alert and oriented ×3. I'm now going to ask that he count back from 100 by sevens for a minute and see how accurate that will be. So why don't you go ahead and start that?
100, 93, 84, 77,
Well, why don't we try again? Why don't we start again?
100, 93, 84, 77, 70.
I think we're a little
63.
off, but for the purposes of this video, we will assume that he was correct.
Sorry.
Okay, now we're going to test comprehension as well. So I've written in some instructions on this piece of paper, and he's going to read it and do what it says. You can read it out loud.
Take paper in left hand, fold it in half, and place it on the floor.
Very good. Comprehension is intact. We're going to ask him, test his long-term memory. So, what did you do for your birthday party last year?
We went to the beach.
Okay, very good. And we're going to test his short-term memory. So, I am going to give him 4 words, ask him to repeat those words, then count backwards from 20, and then repeat the words again. So, your words are light, coffee, chair, and bug.
Okay, light, coffee, chair, bug. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Light, coffee, chair, bug.
Great. Short-term memory is intact. I'd like to thank you for participating with us today. I really appreciate it.
You're welcome.
Okay, thanks.